Nursing is often described as both a science and an art, and this becomes clear through ethical responsibilities we carry. As nurses, we are entrusted with the health, dignity, and well-being of the people we serve. Our role goes beyond performing procedures or giving medications. It involves caring for individuals as whole persons and supporting them during their most vulnerable moments. The Code of Ethics serves as a compass, guiding how we think, act, and make decisions with compassion, respect, and accountability. Today, we will walk you through the key ethical responsibilities of registered nurses and share examples of how these principles are applied in real practice. Preamble and responsibilities of nurses. We focus on 4 core principles of nurses to promote health, prevent illness, restore health, and alleviate suffering. First, promoting health means empowering individuals and communities to make healthier choices. We do this through health teaching, lifestyle guidance, and early identifications of risk. Health promotion encourages patients to understand their condition and make informed decisions. Next is preventing illness, which includes immunization, screening, hygiene education, and ensuring safe environments. Nurses teach patients about medication adherence and early symptoms recognition to prevent complications and protect community health. Third, restoring health. Nurses provide holistic, evidence-based care to support recovery. This includes physical care, emotional support, rehabilitation, and coordinating with other healthcare professionals. We also educate patients and families so they can manage conditions safely at home. Lastly, alleviating suffering. Nurses address physical pain, emotional distress, and social needs with empathy. We ensure comfort and dignity, especially for patients dealing with chronic illnesses, disabilities, or end-of-life situations. Our presence and compassion deeply influence patient experience. Registered nurses and practice. The ethical expectations of registered nurses. First is responsibility and accountability. Nurses are accountable for their decision and make practice safely, ethically, and within their scope. Our action directly affects patient outcomes, so integrity is essential. Next is competence. Nurses must continually maintain and update their knowledge and skills. This includes lifelong learning, adapting to new technologies, and recognizing when we need guidance. Competence ensure high quality and safe patient care. Third, nurses must protect their personal health. Managing stress, fatigue, and overall well-being is necessary because impaired health can compromise patient safety. Fourth is sound judgment in accepting or delegating tasks. Nurses must accept tasks only when they are competent to perform them and delegate only to individuals with proper training and legal authority. Refusing unsafe or inappropriate tasks protects the patient and the nurse. For example, a nurse updates knowledge and skills through advanced wound care training and applies them safely in practice. Another example is a nurse refuses to perform a high-risk procedure without supervision to prevent potential harm. Lastly, delegates medication administration only to trained personnel to ensure patient safety.
Registered nurses and society or environment. Nurses have a responsibility not only to individual patients but also to society as a whole. First is primary responsibility to people. The nurse's priority is always the safety and well-being of the patient, regardless of background, status, or beliefs. Next is respect for rights, values, customs, and beliefs. Nurses must acknowledge diversity, cultural, spiritual, and personal, and adapt care accordingly. Respect promotes trust, enhances patient participation, and leads to better outcomes. Next is informed consent. Nurses play an important role in ensuring that patients understand medical procedures and have the freedom to make decisions without pressure or misinformation. Next is advocacy for equity and social justice. Nurses are expected to support fair access to care, challenge discrimination, and raise awareness about healthcare disparities. Examples are: first, a nurse provides clear explanations about treatment options, ensuring the patient can give informed consent. Next is a nurse joins a community project that delivers healthcare services to marginalized groups, advocating for equitable access and resources. This section emphasizes that nurses are not passive observers, but active advocates for fairness, safety, and human rights. Number 4. Registered nurses and the profession. The nursing profession continually evolves, and nurses are expected to help shape its development. Nurses play a key role in developing and implementing standards in practice, management, education, and research. Participation in professional organizations, committees, or research initiatives helps enhance safety, effectiveness, and quality of care. This also promotes leadership and professional growth within the field. Example: a nurse participates in a task force that revises hospital policies on infection control, contributing to higher standards of patient safety. This responsibility reflects the idea that nurses are not just followers of rules, they help create and improve them. Number 5. Registered nurses and co-workers. Nurses work in a team setting, and ethical practice involves maintaining collaborative and respectful relationships. Nurses should foster cooperation, open communication, and mutual respect to ensure safe and seamless care. However, when a co-worker's behavior threatens patient safety, nurses must take appropriate action, which may involve reporting or intervening in a professional manner. Example: a nurse notices repeated medication errors by a colleague and reports it through proper channels, prioritizing patient safety while advocating for support or training for the co-worker. This highlights that ethical responsibility includes protecting patients even when it feels uncomfortable or difficult. In conclusion, the ethical responsibilities of registered nurses serve as a foundation for compassionate, competent, and just practice. These responsibilities are reflected not only in how we treat patients, but also in how we conduct ourselves, interact with others, and contribute to our profession and society. By upholding these values, we preserve the integrity of nursing and strengthen the trust placed in us by the people we serve.